Here's a quick experiment. Look down at any fingernail on your hand, press it firmly for 2 full seconds, then release. That flash of white fading back to pink is something clinicians quietly rely on to gauge how well blood is moving through your body. No stethoscope, no cuff, no waiting room required. It turns out your nails hold on to a lot more information than most people ever realize, and after 60, that information becomes especially worth paying attention to. Think of your nail bed less like a fingernail and more like a dashboard warning light for your circulatory system. It's small, it's easy to overlook, and most of us were never taught what it's actually telling us. Today we're going through 4 things your nails can reveal about your cardiovascular health. 4 signals that don't require a single piece of medical equipment to check, just your own 2 hands and a few minutes of attention. The last one on the list is the one people are almost never told about, so stick around for that. Before we get into it, if anyone in your household has dealt with heart trouble, drop that in the comments. It changes how closely you'll want to watch for these signs in yourself. Let's start with some quick biology, because it makes everything else easier to understand. Underneath the visible part of your nail sits a strip of active living tissue called the nail matrix. This is the factory floor where new nail material gets produced, and like any factory, it depends on a steady delivery of oxygen and nutrients from the bloodstream. The vessels feeding that area are microscopic, some of the smallest in your entire body, which means they're also some of the most sensitive to disruption. When your circulation starts to falter anywhere in the body, these tiny vessels are frequently among the first to show it, long before anything more obvious develops. Here's why age changes the picture. In your 30s and 40s, the cardiovascular system runs with a wide safety margin, plenty of backup capacity to compensate quietly for small problems. That margin shrinks as the decades add up, not because anything has gone wrong, but because 6 or 7 decades of continuous operation naturally narrows the buffer. Which means signals that would have stayed hidden in a younger body have a better chance of surfacing where you can actually see them, right at your fingertips. There's also a practical reason doctors don't always catch this during a routine visit. A standard appointment simply doesn't leave much time for a detailed nail exam unless something looks obviously wrong. So this stays mostly in textbooks and specialist training, rather than reaching the people who could actually use it day to day. It's also worth saying plainly that none of these 4 signs work as a standalone diagnosis. Think of them less like a verdict and more like a set of early nudges. Small, low-stakes clues that are worth paying attention to precisely because they cost nothing to check and can sometimes surface months or years before anything more serious becomes obvious. The goal isn't to replace your doctor's judgment, it's to hand you better questions to bring into that conversation. Let's get into the first one, starting with something you can try along with me right now. Sign 1. How fast your color comes back. Hold one hand roughly level with your heart. Choose a nail. Your index finger works well, and press down firmly with a finger from your other hand for about 2 seconds. Let go and start counting. In someone with healthy circulation, the pale spot fades back to normal pink in under 2 seconds. If it consistently takes 3 seconds or more, especially across several fingers, that's worth noting. This is called a capillary refill check, and it's measuring how efficiently your smallest vessels, the microvascular network, bounce back after being compressed. A second, complementary check, press the back of your hand against your cheek. It should feel roughly the same temperature as your face. If your hands run noticeably cooler than the rest of you, even indoors, that's another hint about reduced circulation at the extremities. Slow refill time has been linked in research to several cardiovascular concerns in older adults, including reduced pumping efficiency of the heart and undiagnosed irregular heart rhythms, both of which carry elevated stroke risk. One caveat before you worry, a borderline result of 2 to 3 seconds, especially with cold hands or if you're on certain blood pressure medications, often isn't meaningful on its own. Warm your hands, try again, and pay attention if it's still slow and consistent. Consider a composite scenario, the kind of case clinicians describe often. A retired firefighter named Marcus, living in Erie, Pennsylvania, tried this exact test after seeing something similar mentioned online. His count ran close to 5 seconds on more than one finger, more than once. He mentioned it to his doctor almost apologetically the next morning, expecting to be told it was nothing. Instead, further testing turned up an undiagnosed heart rhythm irregularity, one strongly associated with stroke risk in people his age. Starting appropriate treatment early is believed to have meaningfully lowered his risk going forward. Sign 2. Color changes at the base of the nail. This one is called cyanosis, and it shows up as a bluish or purplish tint, usually most visible near the base of the nail. There are two versions, and telling them apart matters. If the tint appears only on your nails, while your lips and the inside of your mouth stay their normal pink, that's peripheral cyanosis, a gradual sign developing over weeks or months that circulation to your extremities has slowed. It's a signal to watch, not an emergency. But if that bluish color also shows up on your lips, tongue, or inside your mouth, that's central cyanosis, and it means your blood isn't picking up enough oxygen at the source. That combination calls for urgent medical attention, not a wait-and-see approach. Persistent peripheral cyanosis in the nail beds has been associated in medical literature with early heart failure, certain valve conditions that go unnoticed for years, and chronic lung conditions that eventually place extra strain on the heart. Heart failure, in particular, becomes more common with age and is frequently missed, partly because early symptoms are so unremarkable. No chest pain, no dramatic collapse, just a gradual decline the body quietly absorbs. A composite example, a retired librarian named Priya from Sacramento noticed a faint purple tinge near the base of her nails that she assumed was just poor circulation from cold mornings. It was her adult son visiting for the holidays who pointed it out and suggested she mention it at her next checkup. An echocardiogram revealed early-stage heart failure, caught early enough that medication and lifestyle changes kept it well managed, likely preventing a hospital stay down the road. If you notice this kind of tint, check it in natural daylight near a window and see whether warming your hands changes the color. If it doesn't, mention it to your doctor and ask specifically whether imaging of your heart makes sense. Sign 3. Nails that grow slowly or break easily. If your nails seem to chip, split, or peel more than they used to, and you're trimming them far less often than you once did, that's worth a closer look. Slow, brittle nail growth often means the nail matrix isn't receiving enough nutrient and oxygen-rich blood to build strong new tissue. In older adults, one common cause is peripheral artery disease, narrowing of the arteries supplying the arms, legs, and hands due to plaque buildup. Here's the connection most people never hear. The same plaque responsible for heart attacks and strokes, when it forms in arteries feeding the heart or brain, can also build up in the smaller arteries running out to your fingertips. Finding plaque in one location raises the odds it's forming elsewhere too, which is part of why peripheral artery disease is considered such a strong predictor of future heart attack and stroke risk. There's a recognizable cluster of symptoms worth knowing together rather than in isolation: brittle, slow-growing nails, hands, and feet that stay cold and take a while to warm up, and leg discomfort, cramping, or heaviness. That shows up during walking, especially uphill or on stairs, and eases with rest. That walking-related leg pain has a specific clinical name, claudication, and it's considered one of the more telling signs of significant artery narrowing. Take the composite story of Sam, a retired auto mechanic from Duluth, Minnesota. His nails had been brittle and slow-growing for years. He blamed decades of working with solvents and cold Minnesota winters. What actually got him to a doctor was mentioning, almost in passing, that his legs ached climbing the stairs to his apartment, something that had crept up gradually over about a year and a half. A simple ankle brachial index test, comparing blood pressure readings at the ankle and the arm, confirmed moderate peripheral artery disease. A structured walking program and updated medication brought his risk down substantially. His nails had been signaling the problem for roughly 2 years before anyone connected the dots. If your nails have become noticeably more brittle over the past year or two, and you also notice heaviness or cramping in your legs while walking, ask your doctor specifically about an ankle brachial index test. It's quick, painless, and can identify this condition early enough to make a real difference. Sign 4. The crescent at the base of your nail. Look just above your cuticle. Do you see a small, pale half-moon shape? That's called the lunula, and it's the visible edge of the nail matrix itself, the place where new nail tissue is actively being built. Very few people are ever told to pay attention to it, which is exactly why it deserves the last spot here. What matters isn't just whether a lunula is visible, but the overall pattern and any changes in color. In most healthy adults, the thumb and index finger show a clear lunula. The middle finger usually does too, and it becomes less consistent moving toward the pinky. That variation alone is completely normal. What's worth noticing is when a lunula that used to be visible disappears, when lunulas across multiple fingers fade out at once, or when the color shifts away from pale white. Color changes each point somewhere specific. A reddish tint has been linked in some clinical research to congestive heart failure and certain rheumatic conditions affecting the heart. A bluish tint suggests the same oxygen and circulation concerns covered earlier with cyanosis. A lunula that fades to nearly invisible pale can point toward anemia, which carries its own real connection to cardiovascular strain. Consider Ruth, a composite case, a 71-year-old former high school principal in Tucson, generally in good health. During a phone call, her daughter, a hospice nurse, mentioned offhand that she hadn't noticed Ruth's lunulas in a while. Ruth hadn't thought about them at all and felt a little silly bringing it up at her next physical. Her doctor didn't dismiss it. A complete blood count and cardiovascular workup revealed developing anemia, along with early signs of cardiac strain, both caught and treated before they progressed further. That small, easily missed detail turned out to be the earliest warning sign available. Check your thumbs and index fingers now in good light. If the lunulas have mostly disappeared, shrunk noticeably, or changed color, bring it up at your next appointment and ask specifically for a complete blood count and a cardiovascular risk assessment. Putting it together. Knowing these 4 signs only helps if you actually use them. So here's a simple way to do that. Sometime this week, take both hands to a window with good daylight. Check the color at the base of each nail. Notice whether nails feel brittle or seem to be growing slowly. Run the capillary refill test on a few fingers and time it. Look for the lunula at the base of each nail and note the pattern. A quick photo of both hands makes it much easier to track subtle changes over the following months. If you notice anything that matches what we covered, write down which sign, which finger, and roughly how long it's been present, and bring that note to your next appointment. If you spot 2 or more of these signs together within the next month, don't wait for your annual physical. Call your doctor's office, describe what you found, and ask whether you should be seen sooner. One important boundary: none of this replaces an actual clinical evaluation. A single sign in isolation isn't a diagnosis. What matters is the complete picture, including your history, medications, and everything else your doctor considers during an exam. These 4 signs are meant to make you a better informed participant in that conversation, not a substitute for having it. It's also worth remembering that none of these changes happen overnight, and neither does meaningful improvement once something is caught. Circulation, nail growth, and vascular health all respond gradually to the changes people make. Walking more consistently, staying on top of blood pressure and cholesterol management, working with a doctor on medication that fits your specific situation. The point of catching something early isn't to alarm you, it's to give that gradual process more time to work in your favor. Your body has been sending you information your whole life, in ways both obvious and easy to miss. What's different about being past 60 is that you now have more experience reading your own body and more access to care than you've ever had before. Meaningful health improvements are absolutely still possible at this stage of life. Research consistently backs that up. The nails you barely glance at most mornings may be one of the most accessible early warning tools available to you. Now you know what to look for. If this was useful, subscribing helps this kind of practical health content reach more people who could use it.